our our effort and our achievement in health sector. We can tell on two headlines, whichever you can take. One is the paradigm shift in approach from the treatment of disease to the wellness of mankind. Previously, it was that only health means to treat the disease. Now, the focus is different. That means we think for the wellness of the mankind, wellness of the all people of the country, not only India but also to the world. Honorable Prime Minister Shri Narendra Modi led government has made Indian healthcare future ready, which we have observed during COVID also. The Narendra Modi led government brought a compassionate approach in healthcare by making it accessible, available, and affordable to all. Making healthcare, this is another one, third one. Making healthcare the topmost priority and bringing reforms in healthcare is the core philosophy of the Modi government. And the last one means so many others can be told, but now I am telling them in my speech. There is a compassionate approach to healthcare and making healthcare everyone's effort, not only for the doctor, nurses, and paramedical staff, it should be everyone's effort, is the biggest success of the Modi government. Under the visionary leadership of the Honorable Prime Minister Shri Narendra Modi ji, a proactive approach has been adopted by the government and a paradigm shift took place in the healthcare sector. A new approach to health and wellness become the core of health sector governance rather than just treating the sick persons. Ms. Kiran Majumdar Shah, from an article which she wrote dated 6 June 2022, the Narendra Modi government has been able to successfully make healthcare a national priority, deliver affordability and accessibility, enable preventive health approaches, and drive value across the complete spectrum of the healthcare ecosystem to a certain point. Moving forward, about the noted founder, chairman of Narayana Health, Dr. Devi Shetty, who has articulated in the book Modi at the rate 20, fighting the pandemic, leading from the front, that timely intervention were made, the national lockdown was also imposed to prevent loss of lives, and how India was able to develop its own vaccine and the world's largest vaccination drive was executed. And if you'd like to know about these, so many things have been expressed by our past ICMR director, Dr. Balaram Bhargav, and he has written a book, Go Viral. There is many things you can get which was happened under the cartel. What are the significant efforts were taken? That's the vision of Honorable PM Sri Narendra Modi ji, the Ministry of Health and Family Welfare, through various centrally sponsored schemes and central sector schemes, supplements the effort of the state also. If we come to the mortality ratio, it is very important. But the mortality ratio was in 2014 was 130 per lakh live birth, and it has become changed in 2020. It has come to 97 per lakh live birth. If we consider about the infant mortality ratio, which was 39 in 2014, 39 means another again per lakh life path, and 28 in 2022 per thousand of life path. This is per thousand life path, and that was maternal mortality was per lakh life path. The neonatal mortality ratio and under 5 mortality ratio, which was 26 in 2014, and it has become 20 in 2020. That is also per thousand life path. We provide it. And if you come to the under 5 mortality rate, that was 45 per thousand life path, and now it has come to 32 per life path. And if we come to the major schemes, regarding the major schemes such as the National Health Mission, Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana, Pradhan Mantri Ayushman Bharat Health Infrastructure Mission, establishment of, this is very important, establishment of new medical colleges. This is vision. Every district should have medical college. And a provision has become made. The district hospital has become converted to the medical college. And the national program of prevention and control of, look, cancer, diabetes, CVD and stroke. It is a kul milakar NPCDCS. Even the National Vector-Borne Disease Control Program, that means this government is also very much keen about the mosquitoes, flies and all these, the mosquito-borne disease and all this. Every year, central government gives fund to all states to control the vector-borne diseases. Pradhan Mantri Shastra Suraksha Yojana, PMSSY. The government is also ensuring holistic health care through Ayushman Bharat Yojana. Yojana stands on the 4 pillars, which are Ayushman Bharat Health and Wellness Centers, Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, Ayushman Bharat Digital Mission, and Ayushman Bharat Healthcare Infrastructure Mission. If we come to the total released fund, this is if we compare apple to apple, that means 2006-7 2013-14, and again 2013-14, 2014-15 to 2021-22. This is 4,27,501 crore, and that was 1,59,832 crore. If we come to the aims, in 2012 and 13, 6 aims started their academic session. But 2014 onwards, what happens? By following the vision of our Honorable Prime Minister Shri Narendra Modi ji, under PMSSY, Pradhan Mantri Shastra Suraksha Yojana, 16 major projects from new aims in various states of the country. What are those states? This is Uttar Pradesh, Maharashtra, Assam, Jharkhand, Gujarat, Telangana, Jammu and Kashmir, Bihar, Haryana and Tamil Nadu are running. In this way, the Honorable Prime Minister Sri Narendra Modi-led government has made Indian healthcare future ready. Not only that, only stating the aims. Again, on 30th November 2022, the Cabinet has approved outlay for 16 new aims, more fund, with a fund of 20,944 crores, a fund of rupees 10,595 crore has already been released. While talking about the COVID prevention, that as on 20th December, 102.55 crore first dose, 95.12 crore second dose, and 22.34 crore precaution dose, which is a total of 220.01 crore vaccination have been given. If we think about the vaccination Moitri program, India has supplied COVID-19 related medical and other assistance to over 150 countries since the beginning of the COVID-19 pandemic at a very affordable price. For fighting the pandemic, the government has developed, this is also within a very short time, 3,388 testing laboratories from 2022 to now 2022. This is a very hard task, but this government has done it. If we talk about the vaccination, there is a Mission Indradhanush. Far prior to this COVID, not only now, as soon as Narendra Modi government has started its work in 2014, that Indradhanush mission has come. And the Mission Indradhanush, the mission was announced in December 25, 2014. I can tell you, at that time I was really astonished, because in our time, when we became doctor, we have seen if any patient comes and diagnosis is definitely encephalitis, we have to count the hours and days when the patient will leave us. And the encephalitis vaccination is so costly. But this government has started these things. The Mission Indradhanush has immensely contributed to filling the gaps and making lasting gains towards universal immunization. Under Ayushman Bharat, this is a very important thing. मोदी जी जो कहते हैं वो करते हैं. Ayushman Bharat Health and Wellness Center Yojana, as on 20th December, a total of 138,122 health and wellness centers are now functional. Our target was 1,50,000. Only 11,882 is to be done. In a very short time, it is about more than 75%, possibly it has crossed 80%. If we think about the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, it is the world's largest health assurance scheme. The government has provided health coverage up to rupees 5 lakh per family per year to around 10.74 crore poor and vulnerable families. The total number of Ayushman cards issued till date is 20.24 crore, and the total number of hospital admission, that is also 4.22 crore. The government is also taking care of the citizens' health and all kinds of health, not only physical health, but also the mental health. This is the first time in India the government has thought about it. There is a